Prava. Welcome back to another session of Modern Concept of Childcare. In today's session, we will be discussing about the statistics which are vital related to child health. So, what is vital statistics? Now, these are some numerical records or numerical numbers, we can say, uh, about certain events such as birth, marriage, death, or occurrence of diseases. So these are some numerical records by which we can study the health or the growth of a particular community. Well, so this is what we mean by vital statistics. Now, in child health, we will be specifically learning about child morbidity and child mortality. But before going straight into the topic, that is child morbidity and mortality, let us first understand why is it important to learn about this particular topic. Why is it important to know about this vital statistics such as the child morbidity or child mortality? So there are several uses of this vital statistics. So we are going to see that what are the mortality rates or morbidity rates present in child health and how that is going to help us. But before that, we are going to see how what is the uses of those rates. What are the uses of these mortality and morbidity rates? So the first thing is that we have already discussed about the national health and national health programs and the policies, right, in the earlier part of the in this unit. So there we have learned that the government have established various health programs or health policies in terms of providing better health care to the community and in terms of providing good nutrition to the children, about education. So we have already seen that these programs are there, or the government have already established these programs and policies. Now, when we will have a record of these numerical records or the vital statistics of these events like birth or deaths, this is going to tell us that the impact of these national health programs, or whether it is effective, or whether the health programs are being carried out properly or not. So these vital statistics are going to help us in evaluation of the impact of national health programs or the various health policies what we have. The next one is, with these vital statistics, we can get to know that what is the causes of disease, or why these rates are more, and whether the death rates are more, or the how the birth rates are taking place in the community. So these things are going to help us in planning better for the future. So it is also going to help us in planning better in terms of disease control. So how to control a particular disease, or in which all areas we are lacking, all those things we can evaluate through these vital statistics. It also tells us about the hereditary nature of a particular disease. So, with these numerical records, we can also get to know that what is the hereditary nature of a particular disease. The next thing is, it is very, very important in research activities. So, it is considered as a primary tool in research activities. Now, whatever the research are taking place in the community, it is the vital statistics are something which helps the researcher in doing his research activities. The vital statistics also helps us to determine the health of an individual or the community or a particular nation. And we can, with this vital statistics, with these numerical records, we can also compare the health of two nations, or one the health of one nation with other nation. So these are the uses of vital statistics. Now, I think you have got an idea that what is vital statistics and why is it important to know about vital statistics. Now, in this session, we will be particularly looking at child morbidity and mortality. There are several vital statistics, but in today's session, we will be particularly focusing on these two aspects, that is child morbidity and mortality. So before seeing the child morbidity rates, now first let us understand what we mean by morbidity and mortality. So morbidity means deviation from a state of physical or mental well-being as a result of disease, injury, or impairment. So when there is any kind of disease that happens or that occurs to an individual, there will be deviation from their normal health status, right? Their physical and mental well-being. So that is what is called as morbidity. Now, child morbidity can be measured in two terms, that is, in terms of incidence and in terms of prevalence. So, in terms of incidence, we check that what is the frequency of the disease or the rate of the disease, and in terms of prevalence, we see how often the disease happens. So, in these two terms, with the help of these two terms, we can see the morbidity rate of a particular disease. So basically, morbidity means deviation from a state of physical and mental well-being due to any kind of disease, injury, or impairment. The next thing is we need to understand what we mean by mortality rate, or what we mean by the term mortality. So basically, we can say that mortality rate means death rate. In simple terms, it is death rate. So basically, mortality rate means, in simple term, we can say it is death rate. So it measures the number of death in a given population due to any kind of cause, that can be general cause or that can be any specific cause, and it is measured over a specific period of time. So this is what is mortality rate. Now, first let us see what are the mortality rates are there which affects which is related to child health. So the first one which we will see is perinatal mortality rate. So here we will see how to calculate perinatal mortality rate. Now here we have late fetal and early neonatal deaths weighing over 1000 gram at birth divided by total live birth weighing over 1000 gram at birth multiplied by 1000. So this is what the formula is. Now let us understand in details that what this formula actually denotes. So here they are saying that late fetal and early neonatal deaths. So late fetal is around after 18 to 22 weeks of gestational period, and then from then to early neonatal period, till that time, if the child the birth weight of the child is 1000 gram. So at birth, when the child's weight is 1000 gram, then only we will consider minimum weight should be 1000 gram. So it should not be less than 1000 gram at birth. So in this period of time, if the child dies, and here there is one condition that we have to remember, that is the birth weight of the child, that should be minimum 1000 gram. So from the late fetal to the early neonatal period. In that period of time, if a child die, we are going to consider that child in perinatal mortality rate, and that will be divided by total live birth weighing over 1000 gram at birth. So suppose, for example, in a specific period of time, okay, maybe in a specific year we are seeing, or that can be maybe 2015 to 2020, we are calculating what is the perinatal mortality rate for this period of time. So in this period of time, if there was any child who has died in this during this period of his or her lifetime, that is from the late fetal and early neonatal period of time, and their birth weight was minimum 1000 gram, we are going to take that number of death here, which will be divided by total live births weighing over 1000 gram at birth. And then we are going to down where we are writing total live birth weighing over 1000 gram at birth. There we are going to put the number which is from 2015 to 2020, how many live birth we had, and the criteria is that their birth weight should be minimum 1000 gram. So there should be the total live birth number, and this should be multiplied by 1000. So this is how we are going to calculate perinatal mortality rate. Now next is neonatal mortality rate. So as you will, I think you are aware that whom we call as neonates, right? So till the age of 28 days of their life, till 28 days of their age, we call them as neonates, right? So how we are going to calculate neonatal mortality rate? So first we are going to put number of deaths of children under 28 days of age in a year divided by total live birth in the same year, and this should be multiplied by 1000. So for example, if we are seeing that in 2021, what was the neonatal mortality rate of India? So what we are going to do is the number of deaths which happened, before 28 days of life, when their age was, when they're neonates, like under the age of 28 days of age. In that age, if any child has died, we are going to take that number here, and we are going to put in number of deaths of children under 28 days of age in a year, that is in 2021, divided by total live birth in the same year. So in 2021, how many live birth has happened, that we are going to put here, and then this should be multiplied by 1000. So this is how we are going to calculate neonatal mortality rate. Next is post neonatal mortality rate. So how we are going to calculate post neonatal mortality rate? Now the first thing that we are going to take is number of deaths of children between 28 days and 1 year of age in a year divided by total live birth in the same year, and this should be multiplied by 1000. So for example, here what we are going to see is that in a given year, in a specific period of time, or in a specific year, we are going to put the number of deaths of children between this period of time, that is from 28 days to 1 year of age, right? So in this period of time, if there has been any number of death, that we are going to take here, which will be divided by total live birth in the same year, whatever total live birth number what is there in that specific year, that we are going to put here, and this will be multiplied by 1000. Next is infant mortality rate. So here in infant mortality rate, you can understand that it is about infants, right? So in infant mortality rate, we basically see that if there is any death, below 1 year of age. So how we are going to calculate this is a number of deaths of children less than 1 year of age in a year divided by number of live births in the same year or total live births in the same year, and this should be multiplied by 1000. So if the child is less than 1 year of age and the child dies in this period of his lifetime, period of his life, then we are going to put that, take that number here. And so the first one will be the number of deaths of children whose age is below 1 year, and that should be divided by total live births in the same year, and that is multiplied by 1000. So this is how we are going to calculate infant mortality rate. So these are some of the important morbidity and mortality rates which you should be aware about in child health. So let us conclude today's topic, that is child morbidity and mortality rate. So here in today's session, we learned about what we mean by morbidity and what is the meaning of mortality. So basically, morbidity means deviation from physical and mental well-being due to any disease, injury, or impairment. And whereas immortality means basically that is the number of deaths, right, in a given population over a specific period of time. So this is what we mean by morbidity and mortality. And then next we learned about the child mortality rates. What are the different mortality rates that we have? So first we learned about perinatal mortality rate, neonatal mortality rate, post-neonatal mortality rate, and then we learned about infant mortality rate. So I hope you have got a better insight about the topic. Thank you.